are a number of things that you can do at home to help relieve lower back pain and decrease the likelihood of it recurring. Applying hot and cold compresses may help to reduce pain and inflammation associated with lower back pain and allow for greater mobility. As soon as you can after injury, apply a cold pack or a cold compress, such as a bag of ice or bag of frozen vegetables wrapped in a towel, to the tender spot several times a day for up to 20 minutes. After 2 to 3 days of cold treatment, apply heat, such as a heating lamp or hot pad, for brief periods to relax muscles and increase blood flow. Warm baths may also help relax muscles. However, you should not sleep on a heating pad, which can cause burns and lead to additional tissue damage. Short bed rest, 2 to 3 days at most, may also be helpful. However, you should resume your activities as soon as possible. Those who rest in bed for a week after lower back pain begins appear to have less back flexibility than those who continue their activities without bed rest. In fact, bed rest alone may make back pain worse and lead to complications such as depression, decreased muscle strength, and blood clots in the legs. At night or during rest, lie on one side with a pillow between your knees, or on your back and with a pillow under your knees. Exercise can be a very effective means of reducing lower back pain. It can also help strengthen back and abdominal muscles. Your doctor or physical therapist, PT, can give you some gentle exercises, such as stretching, to help keep muscles moving and speed up the recovery process. Swimming, walking, and movement therapy can improve coordination and develop proper posture and muscle balance. If you are overweight, your doctor may recommend losing weight to reduce the strain on your back and legs. There is evidence of a link between smoking and lower back pain. Quitting smoking also has a number of other health benefits. Drugs that you can buy over the counter and take by mouth, such as aspirin, naproxen, and ibuprofen, can help reduce stiffness, swelling, and inflammation and ease mild to moderate lower back pain. If over-the-counter drugs don't give you enough relief, your doctor can prescribe other drugs to reduce pain and inflammation. Be sure to talk to your doctor about the risks and benefits of any therapy, whether prescription or over-the-counter. For example, all non-steroidal anti-inflammatory drugs or NSAIDs, such as aspirin and ibuprofen, can relieve pain and reduce inflammation of the disc or nerve roots. However, some, but not all NSAIDs, may increase your risk of heart attack and stroke. They may also upset your stomach and even cause ulcers and bleeding. Your doctor can also prescribe NSAID formulations that decrease your risk for stomach problems. Many other types of drugs can also be used to help relieve lower back pain. These include some antidepressants and narcotics such as codeine or propoxyphene. These are usually taken for a short time if other options don't relieve your pain. Your doctor may also prescribe muscle relaxants if you have persistent spasms in your back muscles. Some medications may cause unwanted reactions if taken together, so check with your doctor if you're taking medications for other health problems. If your pain isn't improved through the use of these medications, corticosteroids given orally or by way of injections may help. Corticosteroids in doses that exceed your naturally occurring levels suppress inflammation. Oral corticosteroids are typically used for a short time to treat acute lower back pain, since long-term use has been related to multiple side effects depending on the dose, how long it is used, and the potency of the drug. Physical therapy for lower back pain can help you return to normal function and activity while also learning how to help control symptoms. It is likely to include both passive and active treatments. Passive treatments are those where you rest while treatment is applied. They include massage and application of cold, heat, electricity, or other form of energy to the back to help with pain management and healing. The most common forms of heat include moist hot packs and ultrasound. Cold treatments, also called cryotherapy, include cold packs and ice massage to minimize pain in the lower back. Fluoromethane is a spray applied to the skin by the therapist, which is usually followed by therapist-assisted stretches. Electric stimulation can also be used to control pain. Some specific types include microcurrent and transcutaneous electric nerve stimulation, abbreviated as TENS. Microcurrent therapy involves applying tiny amounts of electrical current to injured areas to restore normal signaling between injured cells to speed healing. In TENS, gentle electrical pulses are sent through the skin to the nerves to block pain signals before they reach the brain. If TENS is found to be helpful in controlling pain, especially chronic pain, a portable TENS unit can be obtained for home use. These therapies are often combined with others such as gentle exercise. Other passive treatments for lower back pain include acupuncture, chiropractic and other forms of spinal manipulation, and traction. Traction involves using weights to apply constant or intermittent force that gradually pulls the spine into better alignment. Your doctor may recommend that you wear a back brace or corset for a short time. A brace can help maintain good posture and alignment during everyday activities, reduce spinal motion and pressure within the affected disc, and keep the soft tissues of your back warm. Since long-term use of a brace can weaken abdominal and back muscles, exercise to strengthen these muscles is usually recommended as well. As your pain decreases, treatment usually focuses on active rather than passive rehabilitation. Engaging in proper movements and postures and a progressive return to activities usually achieves much better results than prolonged bed rest, which is no longer recommended as a treatment for back pain. Exercise and advice about active treatment for lower back pain are aimed at increasing strength and flexibility and improving poor posture and other bad habits that may have contributed to your pain. Your physical therapist or PT will teach you self-help techniques and show you how to lower your risk of re-injury. For example, your PT will teach you how to bend and lift correctly. You may be advised to avoid activities, at least temporarily, that require repetitive or sustained bending, like gardening, and are likely to worsen your symptoms. If your PT identified a poor or slouched sitting posture during your initial examination, you may be taught about proper sitting posture using a lumbar roll, a special pillow designed to maintain the lordotic curve or hollow in the low back to minimize onset of pain. You'll also be encouraged to continue activities that don't cause pain. However, it is very important to maintain good sitting posture after exercise. You may feel good while exercising, but develop lower back pain a few hours later. After mastering pain control techniques, beginning or returning to aerobic conditioning such as walking, elliptical training, or bicycling will help to heal and keep your back healthy by increasing the flow of blood and nutrients to your back. Your PT can design a program that is right for you. After your pain is under control, your PT will also prescribe exercises to strengthen and restore flexibility to the back and legs and help you maintain correct postures to decrease the risk of back pain. Your PT can teach you exercises to do at home that will strengthen both the trunk and legs. Leg strengthening is particularly important since it will help you lift objects from the floor using your leg muscles rather than those of the back. Your doctor may recommend injection of drugs into muscles or around or near the nerve roots of your spinal cord to relieve your pain. These injections may include local anesthetics to deaden the nerves causing you to feel pain, or steroids to decrease inflammation that makes nerves send abnormal pain signals. Epidural injection, injecting a mixture of corticosteroids and local anesthetics into the area around the spinal nerves, provides a strong local effect that numbs nerves and reduces inflammation. The first injection sometimes produces significant benefit. Additional injections may be given to maximize pain relief. Your doctor will monitor how much corticosteroids were given over a period of time to avoid and minimize any possible side effects. In rare cases, these injections can cause nerve damage. Your doctor may also recommend a facet block injection. The facet joints are paired joints in the back with a cushioning layer of cartilage between them and a surrounding capsule. Twisting injuries can damage the joints. The cushioning cartilage between the joints may also decrease with aging, which can result in pain. A facet block injection is injection of a local anesthetic and steroid into the facet joint capsule, guided by fluoroscopy, a type of live X-ray. These injections may be done several times per year, and there are very few risks associated with them. It is preferable to inject into the nerves supplying the facet joints rather than into the joints themselves. Injections into these tiny joint spaces may lead to rupture of the joint capsule. Successful blocking of the facet joint's nerve supply may be followed by radiofrequency ablation. This procedure involves applying heat energy to a painful nerve, which reduces pain signals from that area and may provide longer-term relief. If persistent lower back pain is caused by a bulging or herniated disc compressing a nerve, procedures to decrease this pressure may be recommended. Some may be performed in a doctor's office under local anesthesia, while others require hospitalization. Full healing after surgery may take months, and there is a risk of permanent loss of flexibility. However, these procedures are well established and have only minimal associated risks. They are generally only used in patients who do not achieve sustained pain relief with more conservative measures. Percutaneous nucleoplasty involves inserting a needle to remove part of the nucleus pulposus, the jelly-like core of the disc, to decrease pressure on nerve roots and relieve pain. This minimally invasive procedure was developed to avoid surgical procedures like discectomy. Decompressor treatment uses a specially designed needle to draw out small amounts of disc material through a tiny tube to decrease pressure on nerve roots. It is performed on an outpatient basis. Intradiskal electrothermal therapy, IDET. This procedure uses heat energy to treat pain resulting from a cracked or dried-out degenerated spinal disc. A special catheter is inserted via a needle into the disc and positioned to lie along the back wall of the disc. Heating this catheter to a high temperature for up to 20 minutes seals the disc wall, which reduces inner disc bulge, irritation of the spinal nerve, and pain receptors within the disc. The biacuplasty procedure uses two probes to deliver heat energy into the disc to disable the nerves and relieve pain. Nerve injury is a rare potential risk, but this is reduced by having patients awake but sedated so they can verbally communicate any unwanted sensations.